I'm going to start with a link to kind of humanizing this story, to actually putting some detail into these stories. As you say, Philippe, it's interesting to hear it from the community perspective. And I'm going to share some of the research that I've been doing over the past few years now, which looks really at transport deprivation in older rural populations, and really how that impacts the community, how that impacts the individual's health, and really where we're going next with this. This has been quite a journey. It started with a big review on the literature. It predominantly focuses on the UK, although I will touch on elements of Europe and America and of Australia, because of the rurality that's experienced in those countries as well. But I'm going to really start by personalising this, which is something as researchers we don't tend to do. But I'm going to give it a bit of context, and I'm going to talk a bit about my family. My parents are elderly. They are both in their 70s, mid-70s. They have a number of long-term health conditions. They're pretty typical of older people, I would say. They are very, very dependent on each other. And they lived in a small village for a very, very long time. They were comfortable there. They had a very close network of support and friends and social events. And their village was quite tight. They had public transport access at the time they were there. They had a post office, community centre, and close access to the nearby town. So they didn't have things like a doctor's surgery, but, you know, that wasn't without... you know, that was easy to get to because they drive. My dad still drives, although as he's got older, and this is a thing for a lot of older people, is that they drive much shorter distances. So they decided about 10 years ago, as they were approaching their retirement, and they were still active at that time, that they would move into the town. The reasons for moving into the town were that they felt they would future-proof themselves for when the time came that my dad didn't drive, when they needed greater access to GPs, to hospital services, to all sorts of other support services that they felt they weren't going to be able to get in their local community. And we thought that made total sense. That absolutely was the right thing to do at that time. So they moved, and they moved into a very nice kind of one floor level apartment. The only problem that they hadn't kind of really thought about was their neighbours. Their neighbours were all young families, and that was difficult for them as they were retired and they liked their quiet and space, and there were a lot of noisy young children. And also they suddenly felt quite cut off from their social support network. So they were driving back and forth to their community to spend time with their friends. So, okay, so we're starting to see this kind of disparity coming in here between living in a rural area and living in an urban area. Both will buy them different things. So it happened that one of their former neighbours passed away, and their house was for sale. It was a bungalow, so they decided to move back to their rural community. It's where they felt comfortable, it's where they felt safe. But by now they're getting older, their mobility needs are changing, my dad's not so confident driving, and at that time we kind of questioned why they might want to do that, given that they need access, you know, to different services now. In this time, in this gap, their public transport access had been completely cut and removed from the village. Their post office and one shop that was remaining had closed. So there was absolutely nothing in the village. There was no services, no transport. They were literally going to be moved there, but they were fine with that. They've embraced the internet. I can shop that way, my mum says. You know, we still drive. We can get to the GP surgery. And if we need anything, our friends are around us. Okay, so we started to see it from a slightly different perspective and thinking, okay, this works for them. But what we hadn't factored into that was I don't drive. I can't suddenly get to see them, because now for me to go to see them in their rural area with no public transport means a 2.5 hour journey, 3 buses, and a wait in a bus stop for my dad to come and fetch me. So suddenly our mobility patterns as a family, and looking at it from an intergenerational perspective, it suddenly becomes very, very different. My children were also not able to see them. They are now, because they have cars. So suddenly we're starting to see this picture of car dependence. You know, this is what they suddenly find they need. They need to be able to drive. But as they're getting older, it's becoming a fine balancing act with where my dad will drive, the time of day that they feel comfortable in driving. My mother doesn't drive, she's never driven. And this is something that, as I went through this research process, I encountered was very typical of women of her generation. Although this is going to change, it at the moment is not there for women who are in those older groups and who are the most vulnerable. So this is where I kind of started from, and all throughout this research process I had their story, my family story, as a kind of typical example of rural living. They're still there, they're still in their community, they're still driving, but they're not driving very far. I certainly wouldn't drive to the nearest city centre, and this is having impacts on where they can get, but they seem quite comfortable with that. They're kind of settled with that idea, and they have embraced the internet. So my mother orders all sorts of stuff and they're happy with that. So for now, things are fine. But it's about, I suppose what I'm trying to say here is that this is a changing picture, and for them, their needs and prioritising their needs has become much more of a fluid thing. I don't think they'll move back now. I think they'll stay where they are, but they are very dependent on each other. And this is something that our research has found, that for families who have the support, who have the social support and the network, it works well. Although the older people are reluctant to ask for help for more leisure activities, they'll ask for help for medical needs, for getting to appointments to hospitals. They're far less likely to ask for help with the day-to-day living aspects, such as shopping or going to lunch clubs and things like that. So I want to talk really, I suppose, about having kind of introduced that and set that kind of scene as a picture. I want to talk about where we started with this. So we started to review literature, and we've gone through a process of reviewing literature. We've also gone through a process of relating this to our locality, because our locality, our county, has gone through huge changes, and has been one of the local areas in the UK to almost experience bankruptcy as a local authority, which is kind of unheard of in many respects, but that's the position that we find ourselves in. And the impact of that on transport has been to remove all bus subsidies. So in total, our location removed 33 bus subsidies, which were predominantly rural routes throughout the county, which has had a huge impact on anybody who lives in a rural location, regardless of age and gender. And so people are not able to access shops, they're not able to access healthcare appointments, work, etc., etc. So it impacts everybody, but our research is probably taken more from an elderly perspective. We know it's very challenging. We've discovered that it's very challenging to provide transport, public transport in rural areas. We have low populations, dispersed settlements, and the distance needed to get to work. As Biliana said, it's about distance from your home to the bus stop. We know we have 50% of people in rural locations who are less than 8 kilometres away from, more than 8 kilometres away from a hospital. So things like that will impact where then people decide to live and what they can actually access. It's very difficult from a cost perspective, which is why our local authority have removed all the bus subsidies. I mean, they've removed lots else, but the bus subsidies was one thing that has obviously had a huge impact on where people can get to. So as a result of that, they've become very car dependent. And car ownership then becomes essential expenditure. And that has an impact on people's households, it has an impact on people's budgets, and then they're prioritising transport costs over other costs. So we know it's public transport is a vital alternative to using the car, but what we found in our research is that in Australia, for example, only 50% of older people have access to public transport. In America, it's about 40% that have no access to public transport, but we know that about a quarter of that is very inadequate. Rural transport in America receives very little attention. due to the dominance of car ownership. Similarly, in Ireland, rural transport policy has been neglected, with a lot of investment focus on improving urban infrastructure. In the UK, we have concessionary bus passes, and they have been a lifeline for people in low incomes in rural areas. And of course, then public transport is not just seen as a means to reach a destination, but provides very valuable socialisation, because we don't see in rural areas many social activities for older people, particularly in smaller rural areas. But it has been reported as also being underused in older age groups. And that may be because there's a lack of clarity on what services are available, to whom, the timing of the services. So if you've only got one bus a day, for example, because that's all that can be justified, then that can make a big difference to how people use transport. So we were looking at this from a kind of social exclusion perspective as well. We were looking at how this excludes people, you know, if they can't get to work, then that impacts obviously the kind of opportunities that they have and how they can progress. For older people, it can mean the difference between being stuck at home and not seeing anybody, which has huge impacts on their health. So I want to talk about older age as well, because I think it's important that we start to unpick older age, because there's a lot of kind of discussion about this, that you become elderly once you become 65 or you get your pension or whatever. And we know that our population is aging, and we expect that about a quarter of our population will be over 60 by 2024. And as someone who turned 65 in 2014, you could expect to live to 85. So that's quite a long time that you are classed as elderly. But obviously your mobility changes over that time. So the largest increase in that kind of elderly cohort, if we want to put everybody together, is going to be the over 85s. And currently we know that they are the most vulnerable. They are the most vulnerable to isolation, particularly women, because the women in these age groups are less likely to have driven, and therefore they are more likely to be on their own in rural locations or in urban areas. But then this does have huge implications for women's mobility and older women and social exclusion. So basically we kind of lump everybody together as being elderly and older, but in actual fact it's become apparent that that's not the case. We kind of have two levels of aging. So we have active aging, where people are between, say, 65 and 75, 60 to 85 really, you could say, where people are much more active. They are still driving, and we are seeing increasing numbers of people in that age group driving. They are more have more disposable income, better pensions, the way pensions have been protected. So they want to go out, so they have a car. They're finding that they need the car. But the impact on these couples, for example, when the partner, the male partner, as we've seen, is predominantly male that are driving. When the male partner, for example, is ill or needs healthcare, the impact for that, for their wife or their partner, is that they can't actually get to see them, and all of a sudden their access to a car and their mobility is completely cut off. So we're seeing changes in that. We're seeing that older women are driving in greater numbers, but currently for our very oldest groups of women, they're not. And this is having huge implications for their isolation. What we're seeing is a knock-on from that when we start to look at social care, slightly digressing that, but when we start to look at the social care picture, is that people in these age groups actually access long-term institutional care at an earlier age, because the cost of the domiciliary care to go out to them in these rural areas is greater. So it tends to form a pattern that these age groups of people will come into urban areas, will come into care homes at a younger age than we would have normally seen if they were living in an urban area and have support networks and lunch clubs around them. So lots to take in here. So what we're seeing a lot is that the car has been a solution to rural transport. We know that older people are vulnerable to transport deprivation and its associated social exclusion by virtue of their immobility. And we kind of are seeing this picture that we are isolating people, particularly where we are seeing these bus cuts, and you know, what alternative is there? I know, Biljana, you mentioned about the demand responsive transport. There are systems in place that we have seen, but we see a slow uptake of those. We see that they can't be sustained, and really we would like to unpick that further. So our next steps with this research has been to identify the needs in our local area. One of the things we did was we took some data from a previous study that we did, and we matched that with census data and did a GIS-based analysis to look at our community in our county area. And we identified 150 rural communities, small rural communities within our county that have no access to doctor surgeries and to shops. So we have picked those areas out now. So as Felipe says, it's always really interesting to get the personal perspective on this. So now we want to go back and we want to talk to those community groups. We want to explore this further, because we can look at this in a linear way. We can look at it from a literature review, we can look at it from a data perspective, but we can't actually see what's happening on the ground from this. We can't actually see how this really impacts people's mobility. What are they doing that kind of overcomes these barriers and challenges? How are they actually getting about? Are they relying on friends and family? Are they not? Are they just thinking, well, this is my lot? We need to understand that, and I think if we can understand that better, then we can go forward and look at what transport solutions might work. Might it be community cars? Might it be demand responsive transport? Might it be better access to things like electric bikes that, you know, the more active, younger, older group might be able to stay active and actually therefore improve their health outcomes as well by remaining active. So what we want to do next is look at some participatory research. We want to actually get into the communities, although this has obviously been paused somewhat with the current situation, but we want to take it to that next level now and actually go out and talk to our older people and see how we can help them to improve their mobility and health and social outcomes. So that's probably all I shall say for now. But if anybody has any questions.